We are genetically designed to live 120 years on average. Immediately in the fossil record, you see severe disparity in both the height, health, and brain size of pre-agrarian and post-agrarian people. All the best evidence shows that we've been apex predators for at least 2 million years. Their brains shrank by 11% for men, 17% for women. As long as it's not this, you'll be scared of this, and as long as it's not this, then everything's fine. Eat all of our garbage.
In this episode, I'm thrilled to introduce our guest, Dr. Anthony Chaffee, a medical doctor from Perth, Australia, who spent over 20 years researching optimal nutrition. Optimal nutrition for us human beings, that'll make sense in a moment. He's an advocate of a meat-only diet. He also runs a YouTube channel called The Plant-Free MD. Dr. Chaffee's journey began at the age of 16 when he started studying molecular and cellular biology. Over the years, he's become an advocate, a leading voice in our industry, promoting a strict carnivore diet. Now, if you've read my book, The Fiber First Diet, you know I'm a big fan of real food diets. I believe that as long as your food is real and it's low in sugar, and when you do have sugar, you balance it with fiber, then you're already doing better than most of the population. But I have to admit, there's sometimes in my life, especially in January, that I also do a strict carnivore diet. Everyone I know that follows a carnivore diet, whether that be my good friend Christian Daly, who was a former international football player, Sean Baker, and other friends that do strict carnivore, you can't argue with the fact they all look lean, strong. In fact, my Maasai friends, when I used to spend a lot of time living in Tanzania, were always lean and strong and pretty much out and out carnivores. Now, at the end of the video, if you do decide to become a carnivore and go meat only, I'd still recommend you have some fiber, because we know fiber produces short-chain fatty acids, which are good for the microbiome. We filmed this episode at the Public Health Collaboration Conference. First, you'll see Dr. Anthony Chaffee backstage as we discuss the pros and cons of a carnivore diet, and then we'll see him on stage when he delivers his amazing speech.
Dr. Anthony Chaffee, thank you for joining me.
Yeah, no problem.
Last year at the conference, you zoomed in, and you've come all the way from Perth to visit us this year.
Yeah.
Thank you very much indeed.
You're welcome.
You know I love your work, but for those that don't know, I've talked a lot about Sean Baker because I've interviewed him so many times. It's our first time chatting together. Carnivore, people that follow my podcast know I love doing Carnivore January, and then I'm just not, I sometimes fall off and have a few other things. But as a doctor, we still get lots of people saying this isn't the way to go, red meat's not good for you. How do we start the conversation of putting the record straight?
Well, I guess it depends on what people's problems are at first. If they're saying red meat's bad for you, and say, well, actually, no, we've evolved on this is what we've been eating for the longest period of human existence. And there's a immutable law of adaptation in biology, which is whatever your species has been exposed to the longest, that's what you're the most adapted to. Life adapts to the situation or it dies. It doesn't succeed and it gets beat out by other species or other versions of that species that have are better able to cope with that situation. So what we've been exposed to the longest, aka red meat, is what we're going to be best adapted to. So that's not bad for us. And
can I just stop you there as well? Because then you get the question, so people say, well, have we always eaten red meat?
Yeah.
And I remember you at a conference once saying, well, that's what they were painting in the caves, that they were catching animals.
Yeah, well, I've never seen a cave painting of a salad, right? So it's always about hunting. It's all about hunting. All the best evidence shows that we've been apex predators for at least 2 million years. Every now and then you'll get a disingenuous article coming out saying, oh, prehistoric man actually was mostly plant-based. And you see, okay, and then that's the headline. And then you actually read the study and see where they're talking about. They're talking about from 6,000 BC to 9,000 BC. And so there's a post-agricultural revolution in an agrarian society. And it's like, no shit. I mean, that's what we're talking about, right? Yeah. We're talking about after agriculture, people got worse. That is very clear on the fossil record. Immediately after agriculture, not hundreds of years, not thousands of years. It wasn't a slow, progressive downfall. Immediately in the fossil record, you see severe disparity in both the height, health, and brain size of pre-agrarian and post-agrarian people, not only in one isolated case, but in every single place around the world that came to agriculture or had agriculture brought to them. Every single time, the height and health of the population declined, and the brain size went down. So people lost about 5 inches on average. Their brains shrank by 11% for men, 17% for women. Their jaws became smaller, teeth became crowded. That's not a genetic issue. That is an environmental issue. That's a malnutrition issue. And Weston A. Price documented this clearly in the early 1900s, showing that you could actually reverse these misdevelopment of the jaws, teeth, and face with proper animal-based nutrition. And you could actually reverse this in families over the generations. You can see this progressively getting worse, and then you could actually bring it back the other way. And so we saw this in real time with the Native Americans, the Native Australians, and now in this century, or in the past century, with the Maasai
I've spent a lot of time living with the Maasai, both in Kenya and Tanzania, and I can tell you they are exactly what I'd like to look like: tall, lean, strong.
For the most part. And now you're having more westernized food coming in.
Yeah. When they then move into Nairobi, they change shape.
But yeah, well, absolutely, yeah, and so there's that disparity, right? You have this traditional animal-based diet. They're eating a lot of meat, drinking blood, drinking milk, and what's happened? Tall, lean, skinny, and healthy. And we have data from the British did a long study in the 1920s, published in I think 1931. It was like a 170-page book. It ended up being a big manuscript. And they looked at the health disparities between two tribes in that area. It was the Maasai and the Kikuyu, who were largely plant-based, but they were alive at the same time, in the same era, in the same conditions, and they interbred, so they're genetically similar. They've been interbreeding for centuries, and it's exactly the same disparities. On average, the Maasai were 5 inches taller. They were 23 pounds heavier of lean body mass. They were 50% stronger. They had better teeth. They had larger brains. And they had next to no illnesses, infectious disease, or chronic diseases especially. And the Kikuyu were rife with them. They went around to different clinics. They went to the hospitals. But obviously, a lot of these people live remotely. So they went from village to village to village to village for years, documenting the different sort of issues that they had and categorizing them and quantifying them. They even found that in the prison population of the Kikuyu, they found that they were very nutritionally deprived. And they found that they were very sick. They were getting a lot of infections, chronic diseases, diabetes. They tried supplementing them. You know, like vegans say, well, just because you're missing things from not eating meat, you can just take supplements. It's fine. Well, no, actually. They gave them the supplements, and that didn't actually fix any of their health issues.
Yep.
It wasn't until they replaced their plant-based diet with more meat that their health actually started to improve. And so, you know, we see that very clearly. And then throughout the 20th century, you start seeing studies coming. Now, no mention of heart disease whatsoever in the Maasai population. The Maasai men were the healthiest. They almost had no issues. Maasai women were second healthiest, maybe a little bit of issues. They had more milk than blood and meat. And actually, the Maasai had started introducing millet seeds at that time too, which is not traditional. Then the Kikuyu women were way down in a distant third place in health. And then below them were the Kikuyu men, because the women actually had a more diverse plant-based diet. They had more, leafy green vegetables along with the millet. And the men, for some reason, just ate a lot of grains mostly. And they were actually the most unwell. And so it's very clear. And then you see the Maasai, as they're eating more and more millet during the 20th century, all of a sudden in the 70s, you start seeing like, oh, hey, look, maybe a couple cases of heart disease. Nothing in the 1920s and 30s. And that's when heart disease became the #1 killer in America. And we're blaming meat for this. Maasai only eat meat, basically. We're animal products. And we were actually, in America, we're eating the least amount of meat in 200 years in the 1920s and 30s, when this became the #1 killer in America. We're eating far more meat in the 1800s. There wasn't a single documented case of death from myocardial infarction on an autopsy. The very first death recorded on autopsy for a myocardial infarction in America was in 1912.
Wow.
And a single one before that. This is not actually a subtle sign. If you die from myocardial infarction, you see this area of blockage in the vessel, and all the area that it vascularizes is dead, and actually visibly looks different. You can see this demarcated line out there. It's like, okay, this dark red damaged heart muscle. Okay, that's dead. It's a very obvious sign. But You can get an arrhythmia from that. Generally, what happens is that now weakened muscle actually ruptures. So there's a big blowout in the wall of the heart. You don't just miss that.
Yeah.
Right?
Yeah.
There's a massive blowout and just blood just everywhere. That's not subtle. Or it scars down and then aneurysms out and then ruptures, or just has this big nasty scar and you get an arrhythmia later down because it screws up with electrical circuitry of your cardiac myocytes, and then you have an arrest, right? So all of those things are very clear, visible signs. Not one single documented case before the 1912, and then 10 years later, 20 years later, it's the #1 killer in America, going from just something that no one had ever heard of,
Wow,
to the #1 killer in America at the time we were eating the least amount of meat in American history. And people say, well, I actually heard this. There's a guy who he says he's a doctor. I don't know why he would not understand how averages work, but he said that people before that just didn't live long enough to manifest these diseases. Some people say that, well, people were just dying in their 30s. No, they weren't. The average life expectancy from birth was 38. But it's an average, so half were above that, half were below that, and the infant mortality rate was extremely high.
Right. Yep.
And people do have heart attacks in their 30s. Kids are born with atherosclerosis now, so we can see that.
Yep.
So no, that's not true. But it doesn't even. So the way they keep statistics are a lot better than just average from birth. They go by, and I have the statistics on my phone. I keep it just for these such occasions. And I talk to people like this that don't understand this. It goes by decades, so 1850, 1860, 1870, all the way up to today, and it goes average life expectancy from 0, and then 10, and then 20, and then 30, all the way up to 80, right? So first of all, why would they be keeping statistics on the average life expectancy of someone who gets to the age of 80 if people weren't living to 80, or not many people were living to 80? Oh, it's just an outlier. They don't have it at 90, they don't have it at 100, but they do have it up to 80. So that's plenty of time to develop heart disease. And the average life expectancy from birth in 1850 was 38, but average life expectancy from 10 was 56. And it goes up to 66 and so on. And so if you got to adulthood, you on average would live pretty much as long as you do now.
Well, there's one British stat from Victorian era, which was the 1870s, that if you were a male adult, so you'd already got through the risk of dying at birth. So I can't remember all the data, but it's in the literature. If you're a male adult living in the 1870s, the life expectancy then was longer than it was last year.
Yeah, I would believe it. Absolutely.
And now we've got vaccines, the NHS cures for nearly,
the most technologically advanced we've ever been in human history, the most advanced medical system that has ever existed, and yet we're not doing very well. We're not doing as well as people that didn't have any of this and were just living a more natural lifestyle in the 1800s. So there you go. So people were absolutely living a long time, plenty of time to develop heart disease, and yet we did not see this at the rates that we did, and we were eating a lot more meat. That sort of statement is just ridiculous anyway. Say, we all died in our 30s, that we didn't live long enough. Well, I was talking to a doctor in India who, everyone's plant-based. They, on average, eat 3 kilos of meat per person per year, right? That's me at lunch, generally. And so or
somebody eating the Eat Lancet guidelines.
Yeah, exactly, yeah. And he's treating people at younger and younger ages for these massive burden of chronic diseases and the sequelae that comes from these chronic diseases and this burden. And he says it's absolutely rampant. He was saying that they have a 30% diagnosed diabetes rate, which is 3 times higher than America.
So I have 2,000 employees in India and been going backwards and forwards there since 2004. And nobody was talking about poor health when I went on visits back then. Everybody looked fine. In just 20 years, the only conversation I have with my employees, I run a jewellery factory, the only conversation I want to talk about on there is diabetes, uncle's just got cancer, auntie's just had a heart attack. And they're frightened because it's happened so quickly over there. I mean, I've got a slightly different view on that. I'm sure the meat plays part of it. I think that they've been okay on this massive high-carb diet for so long, but then when you put the westernized shit over the top of it, so now you're hitting them with fructose and glucose, I think the two together is
Well, the thing is, though, is that they're plant-based, and all that crap is plant-based. Ruffles are plant-based. Oreo cookies are vegan, right? They're not only plant-based, but they're vegan. They're just everything perfect, right? So, I mean, if you just all lived on Oreo cookies and shot heroin, then we would just all be great. It's all plant-based stuff. So they're especially susceptible to this sort of, this sort of predatory marketing, where they say, "Oh, look, this is all plant-based, and as long as it's plant-based, as long as it doesn't have meat, then it's okay for you. Then it's good for you. And it's not going to cause heart disease because it doesn't have meat, it doesn't have fat, it doesn't have animal fat, and therefore it's good for you." That was the distinction that was made in the 1980s. Was that cholesterol was bad for you, saturated fat increased cholesterol, and therefore anything without saturated fat and cholesterol were de facto good for you, which of course isn't true. I mean, things can be, there can be other things that are bad for you. Arsenic doesn't increase your cholesterol, but it's bad for you. And so they didn't look at that side of things. So even if cholesterol and saturated fat were bad for you, which they are not unequivocally, that doesn't mean that there aren't any other bad things out there. And that's the marketing ploy and scheme that has been used. They say, oh, as long as it's not this, be scared of this, and as long as it's not this, then everything's fine. Eat all of our garbage. And so they're certainly susceptible to that because they're eating plant-based. They're doing their vegetarian, traditional Indian diet, but they're getting really, really hurt by this. And that same doctor, the Dr. Ankur Verma, I just had him on my podcast. I'll be publishing that next week. Very interesting guy. Probably be interested in talking to him. He's carnivore, and he's seeing this, and he's trying to get his patients like, hey, you need to stop this traditional crap. You need to eat real food. And he's actually doing studies now looking at the patient population that's coming through his emergency department, and what they eat and what problems they're getting. And he was saying that he just treated a 26-year-old patient, traditional Indian plant-based high carb diet, 26-year-old who had a stroke.
Wow.
And he treated a 17-year-old vegan boy who just had a heart attack.
Oh.
Okay, but we're not living long enough in the 1800s. Yeah, I guess 17 wasn't long enough. And that always bugs me too. I mean, that whole thing is, we weren't living long enough. Guys, first of all, look up historical figures. Every single American founding father died in their 80s and 90s if they weren't killed by something.
Yeah, and I say, go and look in the UK, go and walk around a graveyard, because you will find lots of gravestones from people that died 100 years ago that were in their 80s, in their 90s. Of course, you're going to have some, because we hadn't got antibiotics, we couldn't cure many diseases back then. So, of course, you're going to see quite a lot that are young, but you will still find the 80s, the 90s. You may even find a 100-year-old, maybe even a super centenarian in your local graveyard.
Yeah, and even without that, what was the minimum required age to run for president of the United States? 35.
Wow.
And that was a rule that came about in the 1700s.
Have you just doubled that recently for some reason in the States?
Yeah. but that was the minimum, right?
Wow.
So if the minimum age to even apply for the job is 35, but everyone's dying in their 30s, that doesn't really make sense, does it?
Absolutely.
I mean, we have presidents that had 2 terms, crazy enough, and FDR had 4 terms. So if everyone's just dying in their 30s, that doesn't really hold water. So it's just false. I mean, and these are just people that don't even bother looking up the statistics, or don't even bother Googling historical figures and say, how old was Socrates when they killed him with a plant, right? Well, he was in his 70s, and no one in Plato or Aristotle talked about how he was just the oldest guy in history. It was just amazing. This is just the longest lived person ever. He was just a normal guy, right? And they had to kill him. He was so sharp and so with it. Alexander the Great, I mean, this is part of the historical record. He inherited an army from his father, Philip of Macedon, and some of these guys were in their 60s. The foot soldiers holding a 14-foot steel lance with a 5-foot long steel blade on it, 5 rows deep, so it was this porcupine sort of look to it, and other people had to go through that. It didn't go well. And so they had a 50-to-1 kill rate in a lot of these engagements. Wow. They took over the entire Mediterranean, North Africa, Greece, Turkey, and gone into India. I mean, they took over this massive, massive, massive empire in a matter of years, with guys ranging from in their 20s to in their 60s. And I read a book on this by Dr. Victor Davis Hanson, who's a fellow at the Hoover Institution over at Stanford. Really interesting guy. He's a classical historian, a military historian, and very interesting. And he actually wrote about this, and he mentioned those statistics specifically. And he also said that there was this general that Alexander the Great had, who led one of his wings of the cavalry. This was back when, if you were a leader, you led from the front. And so this guy was on a horse in full armor, swinging a sword, hacking people, 50-to-1 kill rate. And actually, he had a thousands to zero kill rate probably because he was still alive. He was either 76 or 78.
Wow.
On a horse in battle in his late 70s. Right. So, no, actually, people are quite healthy. We know as geneticists, and this is what I was taught in my genetics training 24 years ago at the University of Washington in Seattle, which has they led the Human Genome Project, so we had some of the top geneticists in the world at that time. They were doing the Human Genome Project. And they told us that according to the length of our telomeres, we are genetically designed to live 120 years on average.
Wow.
Meaning that if you just stay out of your own way and don't mess up, you should make it to 120 without doing anything special. Shouldn't have to do all the different tricks and the plunges and the medications and the resveratrol, which probably doesn't work anyway because that's the whole lawsuit for $700 million about
Is that right? I've not heard about
it was a con apparently. Well, that's the allegation that David Sinclair sold resveratrol to some big company for $700 million, and obviously made a killing on it. And they have never been able to reproduce his results that they bought his. This is why you duplicate things. Yeah. This is why any study worth its salt historically had to be independently verified in another lab, in another setting. And now it's just like, oh, you publish that? Great, we'll take it. But we're seeing so many things being backtracked now. Even Alzheimer's said there's going to be these beta-amyloid plaques. They build up. That's causing damage to the neurons and doesn't allow them to work. But I was always a bit skeptical of that anyway, because there were people that had no expression of Alzheimer's disease and they had a head full of these plaques, and they said, oh, well, they were keeping active. This lady was, reading the Bible every day, and that's what kept her brain going, maybe, but it always seemed a bit weird. Now we know that the people that published that study, that paper saying that the beta-amyloid plaques were the cause of Alzheimer's, fudged the numbers, fudged the data, and actually never showed that. Yeah. But they have tenure now, and you can't really get them. They've already published this landmark paper that's made them very, very famous, and now they're just dealing with the fallout and probably don't care too much because they've moved on.
Made their money already and run.
Before I show some of the highlights of Anthony's talk to the delegates, which was absolutely amazing, let me pick up on his last comment about Alzheimer's. Now, from the conversations I've had with brilliant doctors like Dr. Ben Bickman, Mary Porter, Dr. Boz, and many, many more, beyond any doubt in my mind, I'm convinced that the #1 cause of Alzheimer's is, in fact, insulin resistance. I'm not alone in that thinking, and many, many of the people in our medical field that look at diseases and metabolic health also believe in that being the main cause. In fact, so much so, a lot of people are now talking about Alzheimer's as diabetes type 3. But please do subscribe to this channel, because you will find in coming weeks we're going to have lots and lots of chats around Alzheimer's, and in particular, watch out for an interview that I did with Patrick Holford.
Okay, so I just want to give a brief overview of what a carnivore diet is and why I think that it's not just a diet, but it is, as the ketogenic diet has been described, it's a medical intervention. This is something that can significantly help your patient population get out of situations that they may not be able to get out of otherwise. We talked about these so-called non-communicable chronic diseases that make up upwards of 90% of the issues that we treat nowadays as a mainstay of modern medicine. 90% of the deaths in the Western world, 74% of the deaths around the world are these non-communicable chronic diseases. And we say that they're incurable. There's nothing you can do about them. You can just sort of maintain them and hopefully try to mitigate them and slow them down. But as we are seeing in this community with different sorts of diet and lifestyle interventions, you can actually reverse these things. Like we've seen Dr. Unwin with diabetes, like Virta Health, and all these other sorts of great examples of this we've seen presented today. So I just want to go into why that might be, some of these things, and why a carnivore diet might be an even better medical intervention in some of these cases. So what is what is the carnivore diet? Well, first of all, it's a real food diet. It's a whole food diet approach with real foods, made up, boxed sort of nonsense ingredients. We have ketogenic diet, a low carb diet. Okay, but a real food low carb diet, ketogenic diet, so it's like a zero carb diet. But of course, there's the processed ketogenic diet with all the sort of the fake nonsense added to that as well. So we're talking real food, low carb, but even lower carb, and then carnivore diet is a subset of that in. So so a carnivore diet is a ketogenic diet, and it's a real food diet. Okay, so this isn't actually as mysterious or weird or off that people may think that it is. We're eating a lot of meat in a ketogenic diet. It's real food. It's just, okay, we're just only eating that. Okay, well, don't you have to eat plants? No, you actually don't. There's nothing that you're missing from not eating plants, and there's nothing that you're being harmed by only eating meat. Oh, there we go. So why does the carnivore diet work? This is a great illustration that one of our friends here at PHC put together, and it's seeing the roots of these chronic diseases: seed oil, sedentary lifestyle, processed foods, lack of sleep, chronic stress, sugar, these sorts of things can cause insulin resistance. And insulin resistance can then bear fruit on all of these horrible, horrible things. And so treating these with a ketogenic diet, that we now have thousands of studies, randomized controlled trials, with large patient populations looking at specific medical endpoints and finding that we can significantly improve the outcomes or sometimes even reverse completely some of these so-called irreversible chronic diseases. So a carnivore diet is a ketogenic diet, and so the same benefits can be applied to a ketogenic carnivore diet as can be found in these randomized controlled trials, and we have quite a lot of them. It is the most nutrient-dense real food diet. So it's a real food diet, but it has real human nutrition. As my friend Camberi says, this is a proper human diet, and that's why it's biologically appropriate as well. The reason it's biologically appropriate is because it has all of the essential nutrients that we have to have. We don't miss anything by cutting out plants. There are things in meat that you have to have that you cannot get from plants. There is nothing in plants that you have to have that you cannot get from meat. And there are things that can actually harm you in plants. And so the carnivore diet goes a step further from the ketogenic diet because it removes these potentially harmful phytotoxins, anti-nutrients, and digestive disruptors, hormonal disruptors that we'll get to that show up in plants. So this actually is a proper human diet. This is what humans have been eating for the longest period in human existence, since the early onset of the first true human, Homo habilis, 2.5 million years ago or so. So the thing is that it's really just you eat food until something in your body and brain tells you to stop. This is like every single animal on Earth. Koalas don't need a calculator to figure out the macros. They just eat until something tells them to stop eating. You know, they say, well, everything's scarce out in the wild, so everyone's just fighting for survival. Koalas don't fight for anything. I mean, they're just sitting in a tree. They're living in their natural resource, and they're just eating leaves, and then they stop. So why don't we have fat ones and skinny ones and ones that don't have self-control and some that have diabetes and all these sorts of things? They're just koalas, right? Because they're eating what they're supposed to eat, and so their body's working the way it's supposed to work, and they have these internal gauges and on and off switch. They say, okay, I'm hungry, I'm going to eat, now I don't need to eat anymore. So something in them is telling them how much more they need to eat, and then they stop. So the gauge of a proper human diet is it should be able to do that, and it does. And so you just eat fatty meat until it stops tasting good, and you move on with your life, and your body tells you what you need. So optimal would be these sorts of things. So the whole food meat, eggs, things like that, selected dairy, butter, ghee, things like that, and as a condiment. And so those are great. Those are great. So that's what I would say is what you should use for yourself and for your patients as the optimal side of things. Suboptimal, well, organs are great, but the reason that's in there is that you don't want too much. You can get too much of a good thing. They are the most nutrient dense part of the animal, and that's great to a point. But if you're eating predominantly those sorts of things, you can actually get hypervitaminosis Potentially, there's a potential there. So I try to keep things in proportion with the animal. So if you take out an ox, again, we're trying to think, what were we biologically growing up doing? We were hunting animals, we were killing that animals, we were eating that animal, and so you take down an ox or a mammoth, you're going to have a year or more worth of meat available just on that animal, and it's got one liver, it's got one heart, it's got 2 kidneys. So try to keep that in proportion, keep that in mind, that it's amazing nutrition, but you don't need much of it. And so certain animals have evolved the ability to break down specific poisons in specific plants. But if they go outside of that range of plants that they can eat, they can get very sick or they can even die. There's a whole field of this in veterinary medicine where they have different diseases: big head, big tongue, limp neck, crazy cow syndrome. These are all names of diseases, but they're actually from exposure to plants that they're not typically known to eat, and they get very sick from this. And so they know, okay, well, what do you do with an exposure? What do you do with a disease? You give it a pill. What do you do with an exposure? You get the hell away from it, right? So you have lead poisoning. You don't just take pills for that. You get the lead out of your environment. That's the number one thing that you do. And so you have to, as doctors, we need to understand that some of the diseases we're treating are actually exposures. And so we need to get our patients away from that exposure. And we see this in the animal kingdom as well. We actually see the other side of that: malnutrition, not getting the right things. So again, going back to livestock medicine, there's a condition called muscular dystrophy that people here may know of. Did you guys know that muscular dystrophy actually exists in cows? And it's the exact same presentation of disease as we see in the human population. But they figured it out. They actually call it nutritional muscular dystrophy, and that's because they found it's from a selenium deficiency. How many people have asked that question of, is our children with muscular dystrophy have a nutritional deficiency of some sort? Selenium. Well, no one checks selenium, right? So I guarantee you their pediatrician has never checked this. And so that's a question that has to be asked, especially when we're talking about kids being significantly hurt by something like muscular dystrophy. So diet is species specific. So that koala eats one plant. Pandas eat one plant. Those are pretty toxic plants to other animals. So not many other animals eat those things, but they don't eat anything else. And that's very important. So when we're talking about our diet, we need to understand which plants we can eat, which ones we can't eat. And the ones we've been exposed to the longest are the ones that we can probably do okay with. People that have only been exposed to these things for 100 years should probably stay away. People exposed to it for 10,000 years, maybe. But what were we eating 10,000 years ago? Generally not the same things we're eating now. What were we eating 50,000 years ago? There isn't a plant around at the grocery store that even existed 50,000 years ago. We've hybridized these things. We've changed these things either genetically or through modification and breeding. So what we've been exposed to the longest is the immutable law of biology, the immutable law of adaptation. What you've been exposed to the longest is what is more appropriate for you. We've only come to plants very recently, and the plants that we're eating now, even more recently than that, and processed food, not at all. So we don't have very good tolerances towards these things. We have great tolerance towards meat. So evolutionarily, this does make sense. This is a biologically appropriate diet, proper human diet. We see here where the cranial capacity is growing. We're eating more and more meat during this time period. And then all of a sudden, right here with the advent of the ice ages, and basically we're forced to become apex predators or we die, and most other early humans did die. All of a sudden, bam, this exponential growth in cranial capacity up until right around agriculture, and then sharp decline down. So immediately after agriculture, we see a sharp decline in the height, health, and development of early humans. And you can see it right here. So this is, it doesn't have the bottom part of it, unfortunately, but this is out of a textbook on paleoanthropology. And this is pre-agricultural man. Here on the left, this is post-agriculture. This is immediately after agriculture. Immediately before and after agriculture. This does not take hundreds of years. This did not take thousands of years. This was overnight. We see the height and health of the population's decline. And this happened at any time in any location with any food crop that they went to. So every example of agriculture, be it in Samaria, be it in Mesoamerica, be it elsewhere, they found the exact same disparities in the drop in height. Usually dropped around 4 or 5 inches. Jaws became smaller, teeth became more crowded and crooked, had more dental caries, signs of poor nutrition, shorter femurs,
tuberculosis started showing up in the fossil record for the first time up and down the spine. And so everywhere you saw, the height and health of the people declined, and their brains declined. 11% for men on average, 17% on average for women. That's persisted until today. We also see this disparity in the modern era. We saw the same disparity with the Native Americans in the Great Plains who were just eating bison. There's a study in 2001 that showed that they were the tallest population of human beings alive on Earth at the time. And then they switched over to a more agrarian lifestyle because we wiped out the bison, unfortunately. And what happened? Exactly the same thing. They shrank, they got sick. Now they have a far higher disease rate in America. We see this in the Inuit population. You can see steadily that cancer rates are going up, heart disease rates are going up as they're being more involved in a Western society. As anthropologists talk about this difference in the diseases and issues that people contend with, going from a primitive lifestyle to a more civilized lifestyle. They can deal with injury, they deal with infections. That's the major issues of their societies. And then when they go into civilization, they deal with these chronic diseases. Why is that? They're actually living similar amounts of time. It's not that they're just not living long enough. That's not true. It's that they're getting different exposures. And so again, this is not a disease, this is an exposure relationship. And we see that in the Maasai versus Kikuyu. These are two tribes that live in the same area. They're alive at the same time, in the same area, the same conditions. They eat a very different diet. So the Maasai eat animal-based diet. They eat a lot of dairy, raw dairy, blood from their cattle, meat from their cattle, or things that they hunt as well. And they're extremely strong and healthy. The Kikuyu, largely plant-based. You guys, the British, did a large study in the 1920s, over several years, published in 1931, I believe, that looked at the differences between these two populations because it was a very good example of observation. Okay, these people are largely the same. They interbreed. They've been interbreeding for centuries, so maybe even longer. And so genetically similar, alive at the same time, same area, same conditions, just a very different diet, and that's pretty much it. And the disparities were nearly identical to what you see here between these two. The Maasai men were on average 5 inches taller, 23 pounds heavier of lean body mass, 50% stronger, and they had almost no diseases, no chronic diseases, no infectious disease, a very low rate. They went to the hospitals, they got the official records, they went to clinics, and then because a lot of these people were living remotely, they went from village to village to village to village to village. And they did their own medical assessments as well of both the Kikuyu and the Maasai. And they found massive disparities in their health. They found the Kikuyu were very sick. They were getting a lot of infectious disease. They're getting a lot of chronic diseases. They had a lot of nutritional deficiencies. So they said, okay, well, let's correct those nutritional deficiencies they had in a prison population. So they were controlled in a matter of speaking. And so they gave them nutritional supplements. Did not improve their health. Did not improve their infection rate. Did not improve these sorts of diseases. It wasn't until they removed the plants and added in meat to their diet that they started to improve. So there's something they're missing from meat, and there's something that's harming them in plants. So public are going ahead. A lot of people are saying, look, I'm going to try this. This is helping me, so I'm going to do it. But now we need more clinicians to understand that this is a medical intervention, and this is something that is one of the most powerful tools that you can have in your arsenal to treat very serious diseases and get people off medication and get them better, which I think is everyone's goal. I don't think anybody here, any clinicians here are like, oh, I just can't wait to just prescribe meds or anything like that and watch your patient population slowly die and get worse. It's just depressing. This is something you can make them better. And so that's something that I just want to encourage other clinicians to just keep that in mind. That's something that you can do and potentially help your patients. So thank you very much.
There's meat, isn't there? So is part of the confusion, if they're going to talk about the sausages and the salamis that is processed to hell and the ham where the fat's been put on compared to the real meat you're eating, is that part of the problem? Because may that cause a problem still, the processed meat?
Well, it depends on what it's being processed with.
Yeah.
Right? Because if it's processed meat, the meat part of that's fine. It's whatever goes in the process. So they're adding in chemicals, or adding actually in spices and seasonings and sugars and those sorts of things. I don't touch those. And so I don't add those into my meat either. So those will cause a problem if you eat them. Adding a little bit into your sausage, is that as bad as having a whole plate of something? Of course not. There's a gradation there, but that's the problem. The problem is never the meat. And so yes, if you add something harmful to meat,
Yes.
then you can get harmed.
I'm saying
by
they're
that.
clouding the research by lumping it all together. It was never the meat that was the problem.
It was never the
Yeah.
meat. And the thing is that though that research that vilified meat didn't actually look at meat like processed meat like salami. They looked at meat that may show up in other meals, like toppings on a pizza or a hamburger patty in an entire Big Mac meal with sugary drink and nightshades soaked in trans fats and things like that, with carbohydrates and seed oils and all that sort of nonsense. And you've got a 30-gram burger patty, and we're blaming that. No, that's the least part of that entire equation. But that actually is what they did. So they said, well, pizza has meat, fast food has meat, lasagna has meat. So anybody that eats that stuff, anyone who eats pizza, how many times have you eaten pizza? 3 times. They ate meat 3 times. No, there are other things with that.
Yeah.
And so it's very dishonest, and it's intentionally dishonest, and it's to push an ideology, it's to push an economic incentive to the people paying their wages or to further their own wages. And it's completely fraudulent.
Thank you for flying all the way from Perth
Not a problem.
and being here. It's great seeing you again. Thank you.
Thank you.